Good afternoon. I'm here today to assure the residents of Baltimore City that during these unprecedented times, government continues to operate. All essential city services continue. My team is prepared to adjust in real time to the evolving circumstances, and I'm engaged daily with the state and county executives from the surrounding counties. During these unprecedented times, as I'm leading the city through this crisis, I need the residents of Baltimore to do their part and to really stay home. I have a simple message. You must comply with orders designed to limit social gatherings and to ultimately slow the spread of COVID-19. And now I'd like to ask members of my team, starting with Health Commissioner Dr. Letitia Sarasa, to come forward and provide you with an update as it relates to health.
Good afternoon. Thank you, Mayor Young, for your leadership, and thank you to my colleagues and my partners who are here for their support. Currently, Baltimore City has 31 confirmed COVID-19 cases with evidence of community transmission. The Baltimore City Health Department response to COVID-19 remains focused on community mitigation as well as preparation for potential hospital surge. Our focus on community mitigation is in an effort to decrease the potential for further spread of COVID-19 to residents throughout our community, with a particular focus on protecting those at highest risk for severe complications from COVID-19, including adults over the age of 60 and those with underlying conditions such as heart disease, lung disease, and diabetes. I want to take a moment today to discuss 3 major points. First, I want to reiterate that not every person requires testing or evaluation by a physician for the onset of mild symptoms. Second, the Maryland Department of Health updated some of its policies in order to ensure that those at high risk for COVID-19 will be prioritized for testing. And third, the wide adoption of social distancing measures by residents will be one of the most important tools we can implement to reduce the spread of COVID-19 in Baltimore City. Regarding testing, there are a limited number of tests available. While the federal government, hospital systems, and the business community are currently working to increase the number of tests available, the Baltimore City Health Department recommends the following. Patients showing no symptoms do not need to be tested at this time. Patients with mild symptoms but who are otherwise healthy should self-isolate, and these patients do not need to be tested at this time. Patients who have severe symptoms, such as but not limited to difficulty breathing, bluish-grayish skin, difficulty arousing, or new confusion, should seek medical care immediately. Older patients 60 years of age and older and individuals who have underlying medical conditions or who are immunocompromised should contact their physician early in the course of even mild illness to discuss current symptoms and determine if there is a need for further evaluation. I'd like to reiterate that given our current capacity to test, not everyone needs to be tested, nor is there availability at this time for everyone to get tested. People with mild symptoms of fever, cough, and shortness of breath should stay at home and not go out in an effort to decrease the risk of others getting sick. Those with mild symptoms should remain isolated at home until they are at least fever-free for 72 hours without fever-reducing medications, and their symptoms of cough and shortness of breath have also improved, and at least 7 days have passed since the onset of initial symptoms. While at home, they can manage their symptoms by rest, hydration, and medication as needed for their fever. The criteria I just outlined can also be found at cdc.gov. Again, I will reiterate that recommendations around testing may change in the future as testing becomes more widely available. For those who are deemed eligible for testing, the Maryland Department of Health has issued a directive over the weekend for all healthcare providers to test without regard to a person's ability to pay or their type of insurance. Maryland Department of Health has also issued an executive order around prioritization of testing to include residents who are hospitalized with symptoms of COVID-19, symptomatic emergency medical service personnel, healthcare workers and law enforcement personnel, symptomatic patients in nursing homes, long-term care facilities, or in congregate living housing facilities, as well as individuals who are medically fragile, and symptomatic high-risk unstable patients whose care would be altered by the diagnosis of COVID-19. While the state and city work to increase testing capacity, personal protective measures and social distancing remain a vital mechanism to prevent the spread of respiratory illnesses. Personal protective behaviors include things like washing our hands with warm water and soap for at least 20 seconds, or using an alcohol-based hand sanitizer that is at least 60% alcohol, avoiding touching your face, eyes, nose, and mouth, avoiding touching frequent touch points like elevator buttons and doorknobs, cleaning high touch point surfaces with CDC approved cleaners, washing your hands after being in public, coughing or sneezing into a tissue and throwing that tissue away, and washing your hands afterwards. In addition to these personal protective behaviors that everyone should be following, I can't overstate the importance of everyone practicing social distancing measures as we continue in this phase of our response. As alluded to by Mayor Young, some residents may not be following our request to stay home for all non-essential needs and are still gathering in large groups. At the city level and in accordance with state and CDC recommendations, gatherings of over 10 people are prohibited, and generally, the recommendation is to avoid large gatherings as much as possible. Social distancing right now is the most important step everyone in our community can take at this time to decrease the number of people who become ill. Social distancing again is intended to slow down the outbreak of COVID-19 in order to reduce the chance of infection among high-risk populations and to reduce the burden on healthcare workers. If you must go out for an essential reason, stay at least 6 feet away from others. If you and someone standing next to you can extend your arms and touch one another, you are standing too close. Even if you are not a high-risk individual for developing a more serious disease, and even if you are not currently showing any symptoms, you may actively spread coronavirus to a loved one who is at high risk. Please use your best judgment and institute social distancing. The Baltimore City Health Department's website, coronavirus.baltimorecity.gov, remains a resource for residents, employers, and clinicians. Over the weekend, we updated our guidance for clinicians and our advice for employers, both of which can now be found on our website. Every Baltimore resident has a responsibility to keep our community healthy. Your social distancing behaviors and the social distancing behaviors that we implement as a community right now will determine the path that this takes. We must protect our healthcare systems and ensure they don't become overwhelmed, and we must protect the health of our loved ones. Thank you.
Good afternoon. My name is Niles Ford. I'm the fire chief for the city of Baltimore. I've mentioned a myriad of times that the safety of our members and the well-being of our community remains our highest priority and the forefront of every effort we do as we navigate our way through COVID-19. In the interest of the health and safety of our members and the community, last week I made it mandatory that PPE be worn on all responses involving patient contact, which includes N95 masks, goggles, and gloves. This is in addition to what our members are currently doing. We are not taking any safety precautions away. What we've done was enhance the current safety precautions that have already been communicated to all members as we continue to maintain CDC guidelines. Furthermore, we will continue to clean and disinfect fire apparatus and medic units prior being placed back in service. We are being incredibly proactive as we help flatten the curve with COVID-19. On March 18th, we had 6 members encounter a possible COVID-19 patient that was transported to an emergency room. They were all evaluated, showed no symptoms, and subsequently were cleared to return back to work. On March 19th, we were notified that 3 members were placed off duty and were quarantined after having transported a patient suspected of having COVID-19 symptoms. While quarantined, we were notified 2 days later that the patient tested negative for COVID-19. Subsequently, those three members were cleared and returned back to duty. The city of Baltimore and the fire department take preventing the spread of COVID-19 virus very seriously. In response, every precaution is being taken when BCFD personnel respond to emergency calls to treat patients. Conjointly, we want to protect the community and members from COVID-19 and to continually provide quality service. Also, we want all to know that 911 is an emergency line. Subsequently, we really only want people to call 911 when there is a life-threatening emergency. We don't want to over-exacerbate the system. We don't want to overrun our EMS services and our hospitals. The fire department is operating as normal. The men and women remain vigilant and ready and continue to serve Baltimore's community. Our staffing remains steady. I'd like to introduce Acting OEM Director, Assistant Chief Steve Savela.
Thank you, Chief. For almost 2 weeks now, the city's Emergency Operations Center has been fully activated and operational. All hands are on deck. In fact, we were the first fully activated EOC in the state to start preparing. Leading the Corona fight for the emergency management is myself, Chief Wallace, and Captain Brillman. At the EOC, all city agencies and partners continue to operate 24/7, planning and coordinating with our communities, businesses, nonprofits, state, regional, and federal stakeholders. The center is also managing and requesting resources to ensure our first responders, medical teams, and frontline employees have the supplies needed to help those who need our help. In addition, we've secured hotel accommodations for members who may have been exposed to COVID-19. In the past week, our multi-agency planning teams have been working around the clock to tackle very important missions for helping our most vulnerable populations, our children, and our medical centers and hospitals. This week, we continue to work with the amazing men and women from the Maryland National Guard to ensure our kids get the meals they need. The Emergency Operations Center will continue to remain fully activated and fully operational 24/7 as long as it takes. And now, Commissioner Harrison.
Thank you. The Baltimore Police Department continues to adjust and modify the delivery of police services to meet the evolving demands of COVID-19 response. We are working diligently to ensure our officers are safe while simultaneously working to prevent and decrease the spread. This includes the distribution of personal protective equipment, and we are working to procure even more, ramping up custodial duties such as disinfecting our facilities and vehicles, adjusting deployment strategies to ensure continued addressing of crime hotspots, practicing and encouraging social distancing. Again, it is critically important that our officers are being proactive in minimizing the exposure to COVID-19. To protect both, the Baltimore Police Department is assessing and evaluating what calls for service our officers will be responding to. We announced temporary modifications to our arrest procedures to facilitate greater social distancing. We continue to encourage our members of the public to file online police reports and utilize 311 when appropriate. This would include any incident that does not require an immediate police response, like minor fender benders and noise complaints. Last week, we publicized restricted public access to the 9 police district stations. These district stations will continue to operate their front desk to field public inquiries or on-site emergencies. But again, residents are encouraged to utilize online reporting. In light of the state's attorney's announcement, newly enacted BPD policies outline steps to pursue law enforcement objectives while also maintaining public health. But let me be very clear. The Baltimore Police Department continues to enforce the laws in our city. We are leveraging different units within the department to add additional capacity and personnel. The aim is to increase visibility and compliance with the governor's executive orders. This includes our partnership with the Social Club Task Force, which comprises members from the BPD, the Fire Marshal's Office, the Liquor Board, and Health Department. We have created a larger footprint, and we will increase our business checks to encourage voluntary compliance. We will continue to respond to calls from residents to enforce the governor's executive orders, and we continue to work with our law enforcement partners from the local, state, and federal government to include the National Guard. The Guard continues to assist with our city humanitarian efforts. I want to take this time to play down any rumors that might be out there. The National Guard is here to support meal distribution, provide aid in planning and transportation, and logistical assistance as needed. But the Baltimore Police Department is committed to working around the clock to keep the members of the public and the department informed of where the agency stands with COVID-19 preparation and actions. Thank you.
First of all, before we take any questions, I want to thank you all for your continued hard work and dedication to the residents of Baltimore City. These people are out here working around the clock, so we need all of you to do your part and stay home so they can safely do their jobs. I also want to thank the city workers who were here to put up these tents so that we can have this press conference.
The question that was asked was some more detail on the individuals who may have become exposed. All of the individuals that were exposed to someone, they were PUIs. All the PUIs proved to be negative for COVID-19. It's a part of the duties that we do every day. We run calls on a whole list of issues and a whole list of people that have different kind of viruses, different kind of ailments. Our people are taught how to protect themselves by wearing the proper PPE, and that's what we've done here. And we just had to have the people evaluated, and they were subsequently cleared. Oh, person under investigation for COVID-19. The question was that were we ever running lower on any fire stations? The answer is no. We treated that incident the same way we treat if we run a call. If someone's out on a call, subsequently we don't have anybody at that station. There's redundancy in the fire service, so we can move resources around or use resources at other units. So at no time were we understaffed. Yeah, the question was, do we have adequate PPE? The answer is pretty shortly is yes.
Commissioner, can you talk about with the governor's new order today with non-essential businesses being ordered closed? How is the police department enforcing that and the 10-person limit?
Well, just like with the first executive order, we are now making adjustments to make sure that we can enforce the governor's executive orders with the additional closures beginning at 5 p.m. tonight. And when we get calls of non-compliance, where there are gatherings of 10 people or more, we are responding to that and dispersing those individuals and educating those business owners on what's actually required with the governor's executive orders. But we have had a few calls to disperse gatherings of 10 or more, and we will continue to do that. And we will continue patrols and answering calls to make sure that our social distancing task force will go out and make sure that businesses are in compliance. And when we find that they're not, we'll take the appropriate action.